One infectious diseases expert says COVID-19 numbers will continue to fluctuate, but it is not a cause for alarm. And that's because Singapore is well equipped now with preventive and responsive measures. Now, she also cautions that despite the numbers coming down in recent weeks, it's difficult to predict any immediate or short-term trends. And this is due to the June holidays when there are more travelling and social gatherings. Health Ministry data shows there were about 456 cases last week at polyclinics compared to previous week's figures of 485 and 506. And for more, I'm joined by Dr Louisa Sun, Deputy Director of the NUS Centre for Infectious Disease Emergency Response, and she's also a head of the Division of Infectious Diseases at Alexandra Hospital. Dr Sun, thank you for joining me this evening. Question, would you say that the current wave has peaked or might peak later than expected?
Well, as we've seen for a good period of time now, even after we have transitioned to an endemic state of COVID, we are really always going to see some waxing and waning in our COVID-19 case numbers. In some overseas countries, this can be more obviously seasonal variations, but in Singapore, we largely see this correlated to our social factors as well as our community immunity levels, and also, and to some extent, the properties of the dominant circulating strains that we have at any one point of time. So as mentioned, despite seeing the COVID numbers coming down in the last week, I'm quite cautious to say what the trend will be in the acute or short term, simply because we've just entered the June holidays, and this really increases the number of social interactions, large gatherings, family events, as well as, of course, travel. So I wouldn't really be surprised if we do see some case numbers to fluctuate over the next few weeks. But also, as mentioned, I wouldn't see this as a cause for alarm. I think as this is something that we would anticipate, and we have good preventive and response measures to manage these fluctuations.
Now, speaking of the dominant strain, the FLiRT variant, now it's also spreading around the world. What's your outlook for this variant, and do you expect it to change with the ongoing school holiday travels?
So maybe just let me explain the name, the FLiRT variant. It is a rather unique name. And this name is actually derived from two mutations in the sublineages of the JN1 variant, including KP1 and KP2. And these are the two which are responsible for a large proportion of infections we have in Singapore at the moment. And as with all the previous COVID variants we've been hearing about, our top concerns really remain the same. And that is to say whether these mutations in the variants will cause the virus to change their properties. So will they become more transmissible, spread more easily? Will they cause more severe disease? And most importantly, will they cause the virus to mutate and escape our immune systems? So now the good news is with the FLiRT variants, there is no good evidence to say that any of this has happened. So it does not cause more severe disease. It doesn't cause more transmissible disease. And the best thing is that the vaccines that we have now, the most updated vaccines, which are the XBB monovalent vaccines, which we are administering in Singapore now, these still retain very good vaccine effectiveness against the JN1 sublineages, and they also importantly prevent against severe disease. So whereas we may see COVID variants continuing to emerge, again, this is something that we'd almost expect, not a cause for worry, something that we just have to keep monitoring and be aware of.
Right. Now, speaking of being aware of, Dr. Sun, let's look at some of the data from a new YouGov survey. Only a quarter of Singaporeans surveyed are familiar with the FLiRT variant. So how necessary is awareness of new variants when, essentially Singapore is already treating the virus just like the regular flu?
That's a very good question. And I would say that awareness of the new variants, even during this endemic state, is still very important. Of course, thankfully, with the recent variant since Omicron and our vaccination rates as well as our herd immunity, we are really seeing that the consequences of COVID-19 are nothing like what they used to be. But having said that, I think people also still recognize, and we should still be aware of the fact that there remain vulnerable groups, vulnerable patient subgroups within us. These are the elderly, the immunocompromised, as well as those with other medical conditions, for example, that predispose them to more severe disease. And these really are the groups that we still need to do our best to protect. So maintaining our awareness about the presence and the characteristics of any new variants really helps us to make informed decisions about our own health status, as well as really helps our healthcare authorities and agencies to make better decisions about monitoring, identifying, as well as responding to latest disease trends, and so that we can protect our vulnerable populations, as well as prevent strains on our healthcare system.
Right. Yet, in another part of the survey, now, it showed that 2/3 of Singaporeans, they worry about contracting the new variant. So what might be driving some of these worries then?
So, well, firstly, I'd encourage people actually not to be too worried about it. As we said, a lot of these case number trends, as well as disease trends, variant trends we're seeing, are not new. So we're not unfamiliar with new COVID variants emerging at this stage, and FLiRT likely won't be the last one that we're seeing either. But overall, essentially, COVID is also unlike, for example, the flu viruses, which really undergo quite large and frequent shifts in their genetic makeup every so often. So whilst we're going to see new COVID variants emerge, I must say that the impact of these variants we haven't seen are likely to bring us back to the scale of the infections that we have seen earlier, much earlier at the beginning of the pandemic. And so there is also a further protective effect from the baseline level of immunity in our community now, whether this be from the vaccines or people getting infected before. We have, the updated vaccine, and we also importantly have continuing research to make sure our vaccines stay up to date as well as effective against any new variants that are emerging. And we also have our general public health measures that we continue to practice.
All right. Thank you so much for speaking to me this evening. I've been speaking with Dr. Louisa Sun, and she's from the NUS Centre for Infectious Disease Emergency Response.